I'm Tim Dodge. Welcome to IIABNY's new monthly video series about healthcare reform. We've created this series of videos to explain how healthcare reform affects you and your customers. Now we're going to, every month, do one of these videos with a brief discussion of some aspect of healthcare reform, and we're going to archive these videos on the healthcare reform page on our website for you to view at your convenience. Now today I'm going to talk about the timeline for implementation of healthcare reform. Healthcare reform goes by a number of different names. Some call it Obamacare, some call it Healthcare Reform Bill, some call it just Healthcare Reform. The formal name for the law is the Patient Protection and Affordable Care Act, or PPACA, or Affordable Care Act. Any one of those will be describing the same thing. So let's talk about the timeline for implementation of this law. Now, as you are probably aware, the Congress enacted the law and President Obama signed it in March of 2010. Now, in the months following the enactment of the PPACA, several provisions took effect. Most of them 6 months later, so we're talking about the fall of 2010. So for example, insurance companies could no longer deny coverage to children with pre-existing conditions. They had to offer coverage to dependents on a family's insurance policy up to age 26. This primarily affects college students, graduate students, and people starting their first jobs, which may or may not include benefits. A high-risk pool was created for uninsured adults who had pre-existing conditions. An appeals process and an external review process for denied claims went into effect. Small business tax credits to help them pay for health insurance coverage for their employees also went into effect. Grants were available from the federal government for the states to help them create consumer assistance programs. New York has been the beneficiary of millions of dollars under this program. Some of those provisions that took effect in 2010 were already effective in New York because New York had done its own little mini version of healthcare reform earlier in the decade. So, for example, free preventive services like mammograms and colonoscopies, those were already effective in New York. The dependent coverage up to age 26, that was already effective in New York, but not necessarily in all other states. And so that's why it was deemed necessary to put that in the federal legislation. So those were some of the provisions that took effect in 2010. Many of the law's most important provisions, though, don't take effect until 2014. For example, starting 2014, insurance companies will no longer be able to impose annual limits on insurance coverage under health insurance plans. They will no longer be able to discriminate against adults on the basis of pre-existing conditions and gender. So there will be no longer denying coverage on the basis of pre-existing conditions. Small business tax credits to help pay for health insurance coverage will increase up to 50% of the cost. Individuals and their dependents will be required to carry health insurance coverage beginning on January 1st, 2014. If they fail to do so, they will have to pay a federal tax surcharge when they do their tax returns. To help cover that cost, individual federal tax credits will be available for individuals and families with incomes between 100% and 400% of the federal poverty line. In 2010 dollars, that was $43,000 for an individual and $88,000 for a family. That was 400% of the federal poverty line. And most significantly for our discussion is that the health insurance exchanges, self-contained competitive marketplaces for health insurance, will be operational in all 50 states effective January 1st, 2014. Now, even though they don't have to be actually enrolling members until then, they have to have a plan of operation in place and they have to have their technological setup, their computer networks and all that set up by January 1st of 2013, just a few months from now. I want you to know that IIABNY, since enactment of the PPACA, has been working very closely with the governors who have been in office during that time, and with the Insurance Department and the Department of Financial Services and the Health Department and state lawmakers to make sure that there is a significant role for insurance agents and brokers in the operation and the management of the health insurance exchange, and we continue to be involved in that effort. That's it for this episode of the Healthcare Reform Series. We hope you'll tune in for the next one where I will be talking about the structure of New York's forthcoming health insurance exchange. I'm Tim Dodge, and thank you for watching.